Hello, my name is Supriya Aryal, and today I'm going to be talking about my research on the association between food security and health among people living with HIV/AIDS in India. So we all know that HIV/AIDS is a global epidemic that has claimed millions of lives since its discovery, and its effects are disproportionately distributed in developing countries. And this is partly due to the fact that HIV/AIDS is closely linked to food insecurity, as food insecurity increases both the risk of HIV exposure as well as HIV infection rates. And in turn, HIV further worsens malnutrition, creating a vicious cycle. Although India has the third largest HIV epidemic in the world, these links have not received sufficient attention there. So the objective of my paper was to review the current literature available in India exploring these links in order to identify gaps and help direct future research, as well as discuss implications for policy and program development. For my literature review, I surveyed the existing literature in India and identified studies in the following areas. Firstly, the food security and nutritional status of people living with HIV in India, and this also included their nutritional knowledge, attitudes, and practices. The second area was the effects of food insecurity and nutritional status, and this included the effects on the risk of HIV infection, on physical health, and also on the mental health of people living with HIV. And lastly, the third area was effectiveness of nutritional interventions. And so through my literature review, I found evidence of widespread food insecurity and poor nutritional status in people living with HIV in India. This highlights the need for these factors to be considered when planning HIV programs, not just for the physical health of people living with HIV, but also their mental health and well-being, as studies showed food insecurity and undernutrition to be significantly associated with psychological distress and decreased quality of life. Additionally, the methods for each study examining the prevalence of food insecurity was different, leading to inconsistencies which could be addressed by widespread administration of a standardized government survey. And this kind of widespread administration would also allow the customization of interventions depending on the needs of each community. Studies also showed that women were more food insecure and had worse nutritional status, highlighting the need for interventions to strengthen the socioeconomic position of HIV-positive women in India. And furthermore, nutritional education and nutritional supplementation both showed promising results. However, more studies are needed to confirm those results. And that concludes my presentation. Thank you so much for listening.